Okay, well, hello everyone. Welcome to my video. As you know, for my subject for this project, I wanted specifically to study psychedelics and more specifically ketamine in the way that ketamine is used to treat depression. So I don't have a script for this video, but I do have an information on my laptop. So if you see me looking at it, no, you don't. Just ignore it and watch and enjoy. So, psychedelics are also referred to as hallucinogens, and they are psychoactive substances. So, they're substances that affect how the brain works and causes changes in mood, awareness, thoughts, feelings, or behavior. So, psychedelics will alter your thinking, your sense of time and emotions, and they can cause you to hallucinate. Not all psychedelics are dissociative, though, and I will expand on that. So, dissociative psychedelics specifically will cause a user to feel out of control and disassociated from their bodies and environment, but not all psychedelics have that effect. So, some psychedelics that you may have heard of are LSD, DMT, and magic mushrooms. So, LSD is an abbreviation for lysergic acid dithylamide. I now see why people call it LSD. And it was first created in 1938 and it comes from the ergo fungus. So again, like the magic mushrooms, it is fungus based, and that fungus grows on rye and other grains. So if you're ever interested in trying it, make rye bread or something. I don't know. So there's also DMT, which is an abbreviation for diphthalamide triptyptamine. Again, these are really elaborate names, and it has been used for centuries, and it can be found in many plants. So, indigenous peoples from countries like Peru, Brazil, and Colombia have used plants containing DMT for ritual and therapeutic purposes. So, a lot of the times, even though psychedelics are often referred to for their more recreational uses, they do have, a spiritual background as well. And then we have one that I think most people will probably be familiar with, which is the magic mushrooms or shrooms. So different types of magic mushrooms include liberty caps, golden caps, blue meanies, and wavy caps. Very interesting names. And they can be eaten, cooked, or as I mentioned earlier, brewed. So I don't know, man. If you're interested in that, you could have it like with a biscuit or a cookie or something and see what happens. So I'm going to go more into the other ways that psychedelics in general can be taken and what forms they come in. So some can come in tablets, they can come in the blotting paper, as I mentioned earlier. I'll put up pictures of the blotting paper, dried mushrooms and powders. They can be swallowed, placed on the tongue, under the tongue, placed on the sides of the cheek. Powder versions can be smoked, rolled, smoked with tobacco or cannabis, brewed in drinks, snorted or inhaled. Some can be eaten fresh if they're a mushroom. Honestly, psychedelics is one of those drugs where there's something for everybody. It's very inclusive. Everyone has an opportunity to do what they want to do with them, which I just think is so sweet and so amazing. We have not yet touched on ketamine, which is the main focus of this project. So what exactly is ketamine? Ketamine is also a psychedelic, but it is specifically one of the dissociative psychedelics. So it distorts sight and sound and can cause feelings of dissociation. There's also this idea of floating, like an out of body experience. It can be taken as a powder, a tablet, a pill, or a liquid. It can be snorted, swallowed, dissolved in liquids, smoked with cannabis or tobacco, or injected. So again, it's one of those psychedelics where there's an option for everybody. Very sweet. So when sold illegally, it most commonly comes in powder form, but in medical settings, it does come in a liquid form, which can be given to you through like an IV. So ketamine is also used as an anesthetic for humans and animals, which is why a lot of people refer to it as a horse tranquilizer. It causes a state of sedation, immobility, and amnesia. So be wary of ketamine though, because like a lot of the other drugs we've talked about, ketamine can be used as a date rape drug. So ketamine was originally made to replace an anesthetic with severe side effects called PCP, and it works by inhibiting neurotransmitters like serotonin, glutamate, and dopamine, disconnecting the brain from bodily sensations. So again, disassociating you from feelings and pain. Ketamine is made with ingredients like, let's see if I can pronounce these, ketamine hydrochloride, silicea gel, stevia. So if you ever want to add something interesting to your coffee, acacia, citric acid, polyethylene glycol 1450. So side effects include, and these are short-term and long-term, hallucinations, dizziness, slurred speech, difficult conversation, wow, maybe I'm taking ketamine, difficult concentration, memory problems, anxiety, stiffening of muscles, salivation, vomiting, rapid eye movement, increase in heart rate, increase in blood pressure, euphoria, so we have a plus, and depression, which seems kind of counterintuitive based on what this project is, but you will see that it's not. So, now, let's get into how ketamine can be used to treat depression. So, ketamine is specifically used to treat treatment resistant depression, which is different from less severe depression. But what makes treatment resistant depression different is that multiple other forms of medication or just other methods were used to treat the depression, but none of them worked. And there is a specific criteria to be able to use ketamine to treat depression, which I will get into later. But ketamine is not used to treat all forms of depression, just a more severe depression, especially depression that involves suicidal ideation. So recently, a nasal spray called esketamine, which is a form of ketamine, was approved by the FDA in August of 2019. Esketamine is specifically a more potent form of ketamine than just the regular stuff, so lower dosages are needed and used. And a nasal spray can be used in the presence, and it has to be used in the presence of a physician or healthcare provider in a doctor's office or clinic. So this is not a nasal spray that people are casually taking in the morning on their own before they go off to work. Like it's not for allergies. So it is more heavily monitored, thankfully, for good reason. So this includes the monitoring of vitals after taking it and clinical checkups. So since the use of esketamine was only approved 3 years ago, more research still needs to be done to study the effectiveness of ketamine on treatment-resistant depression, but that's not to say that only esketamine can be used to treat treatment-resistant depression. You can also do ketamine through an IV. Research published through the American Journal of Psychiatry has shown that during short-term treatment, the use of esketamine led to a significant decrease in depression scores. A clinical trial published by the JAMA Psychiatry Journal showed that the use of esketamine can also have long-term effectiveness. So after using esketamine, people experience 16 weeks of oh my goodness gracious, people experienced 16 weeks of depressive symptom delay. That was a miracle. So they didn't experience any symptoms of depression for 16 weeks, which is pretty great. It must be noted that in both trials, esketamine, and this is for ketamine in general, but in these trials, esketamine was not used on its own. Ketamine, when it is used to treat depression, is never used on its own. It's usually used in conjunction with another antidepressant that the patient is on. So the use of ketamine can be very efficient since its beneficial effects take place within as little as 40 minutes, which is crazy, especially when you compare it to other medicines that may take, days, months, weeks to work. So when ketamine is used, it is not the first option of treatment, and it is not expected to cure depression. So ketamine is never used as a cure and is never thought of as a cure, but rather something that is used to delay symptoms or relieve symptoms rapidly of depression. So relief from ketamine is sustained with treatment plans that are not solely based on ongoing ketamine treatments. Researchers are questioning the combination of cognitive behavioral therapy and ketamine, because what ketamine does is create new neural pathways that can develop resilience against depression. And the CBT helps patients learn new productive attitudes and behaviors that the brain will be more adaptive to due to the creation of those new pathways from the ketamine. And there are actually multiple reasons why you would be denied ketamine treatment. So it's actually only given to patients with moderate to severe major depression, as I said earlier, or major depressive disorder, and people who have not been helped by at least 2 other depression medications. You cannot have psychosis, or you cannot struggle with psychosis or schizophrenia, because the dissociative nature of ketamine can make those 2 disorders worse. People with a history of substance abuse and substance use disorders, because ketamine can become an addictive drug. Adolescents due to developing brains. People who are pregnant and breastfeeding, and those with symptoms of dementia. So again, as I stated earlier, the long-term effects and side effects of ketamine are still being tested, and people are also questioning whether ketamine can be used to treat depression. Oh my gosh, we already know that. Whether ketamine can be used to treat PTSD, OCD, alcohol use disorders, and other mental disorders. If any new information ever comes out, maybe I'll update you. We'll see.